You have noticed that your hair is falling out? Are you struggling with hair loss? This video is for you. Hello everyone, welcome back to I the Pharmacist. Today we have an important topic to discuss that affects many of us at some point in our lives, hair loss. This is the first video for this topic. We will dive deep into the causes of hair loss, and in the next 3 videos we will explore all possible cures and treatments. This video is only with educational purpose, it is not a medical advice. So whether you are dealing with hair loss yourself or just curious about this common issue, you are in the right place. Let's get started. So firstly, what is hair loss? Hair loss or alopecia can affect both men and women and can occur for various reasons. It can manifest as thinning hair, receding hairlines, or even complete baldness. Now let's explore some of the primary causes of hair loss. Firstly, I want to mention that there are several types of hair loss and a couple of factors that can contribute to this process. So let's break them down one by one. Firstly, androgenic alopecia, male and female pattern baldness. Androgenic alopecia, commonly known as male pattern baldness in men and female pattern baldness in women, is primarily caused by a combination of genetic, hormonal, and age-related factors. Now I'm gonna talk about the key causes and factors for androgenic alopecia. Hormonal factors are central to the androgenic alopecia. In men, the primary hormone involved is dihydrotestosterone, called DHT, a derivative of testosterone. DHT shrinks hair follicles over time, leading to shorter and thinner hair strands. Follicles in the front, top, and crown of the scalp are particularly susceptible to the effects of DHT. In women, the hormonal changes associated with menopause, pregnancy, or conditions like polycystic ovary syndrome can lead to fluctuations in hormones, including increased androgen levels. Elevated androgens can contribute to hair thinning and loss. Another factor is age. Androgenic alopecia is often age-related and typically becomes more noticeable with age. It usually begins in the late teens, so early 20s in men and later in women, often after menopause. It's important to mention the sensitivity of hair follicles. Hair follicles in individuals with androgenic alopecia are genetically predisposed to be sensitive to the effects of DHT. Over time, DHT gradually miniaturizes these follicles, causing them to produce finer, shorter hair strands until they eventually cease to produce hair. Of course, there are other factors related to our lifestyle that can exacerbate and accelerate the progression of androgenic alopecia. Smoking has been associated with increased hair loss in some individuals. Also important to mention is that unhealthy diet lacking essential nutrients can contribute to hair thinning and loss. And the last factor related to our lifestyle is of course stress. Chronic stress, as you may know, is highly to affect hormones and may contribute to hair loss, although it may not be a direct cause. The next type of hair loss is alopecia areata. This is an autoimmune disorder that leads to hair loss in small round or oval patches on the scalp or other parts of the body. Now I'm gonna talk about some key factors believed to contribute to the development of this type of hair loss. The leading theory is that alopecia areata is an autoimmune disorder. This means that our own body immune system mistakenly identifies hair follicles as foreign invaders and attacks them. This autoimmune response disrupts the normal hair growth cycle and leads to hair loss. Another key factor might be genetic predisposition. There appears to be a genetic component to alopecia areata, so individuals with a family history of the condition are at a higher risk of developing it themselves. It's interesting to notice that specific genetic markers may increase susceptibility to autoimmune reactions in the hair follicles. As by androgenic alopecia, there are some environmental triggers, and these triggers can include physical or emotional stress, illness, hormonal changes, and exposure to certain environmental toxins. The next type of hair loss is telogen effluvium. It is a temporary form of hair loss often triggered by significant physical or emotional stress, illness, childbirth, surgery, or major weight loss. This is also the most common form of drug-induced hair loss. Telogen effluvium is a condition where more hair follicles than usual enter the resting telogen phase of the hair growth cycle. When you start taking certain medication, it can appear within the first 2 to 4 months after starting the drug. By this type of hair loss, you can notice increased shedding and thinning of hair. Some medications, including certain types of antibiotics, antidepressants, anticoagulants, and antihypertensive medications, can sometimes trigger telogen effluvium, but these side effects are not often. The next thing I want to talk about is anagen effluvium. This type of hair loss occurs when hair is lost during the active growth anagen phase due to factors such as chemotherapy, radiation therapy, or exposure to toxic substances. Some drugs can cause hair loss by disrupting the active growth anagen phase of hair follicles. This prevents the matrix cells, which produce new hairs, from dividing normally. This type of hair loss usually occurs within a few days to weeks after taking the medication. As you all may know, chemotherapy drugs, for example, target rapidly dividing cells, including those in hair follicles, leading to hair loss. It is typical for anagen effluvium that it is rapid and can result in complete hair loss. Another type of hair loss, which you may not heard about, is traction alopecia, caused by repeated pulling or tension on the hair shafts due to tight hairstyles. Over time, this can damage and weaken the hair follicles. Another type of alopecia is scarring alopecia. This is a group of rare disorders characterized by inflammation and destruction of hair follicles, leading to permanent hair loss and scarring of the scalp. Another interesting cause for hair loss are the hormonal imbalances due to conditions like thyroid disorders. The thyroid is a gland in your neck that produces hormones responsible for regulating various bodily functions, including metabolism. When thyroid gland is not functioning properly, it can disrupt the hair growth cycle, leading to hair loss. Some medications can affect also the hormone levels in the body, which can indirectly impact hair growth. For example, oral contraceptives. Some women may experience hair loss as a side effect of birth control pills. This is typically associated with pills that have a high androgen index, meaning they contain progestins with more androgenic properties. These androgens can potentially cause hair thinning or hair loss in some women. However, many birth control pills have a lower androgen index and may not have this side effect. It's important to note that drug-induced hair loss is usually reversible once the medication is discontinued and the body has a chance to recover. However, the rate and extent of recovery can vary among individuals. And remember, don't make decisions on your own. It's essential to consult with a healthcare provider or dermatologist to determine the specific cause of hair loss and receive appropriate diagnosis and treatment. I hope you enjoyed this video and type of content. If so, please like, share, subscribe. For more videos like this, in the next videos we will discuss all possible cures and treatments of hair loss. See you next time. Bye.